Hi, everybody. We are Group 8, and we are presenting on reducing anxiety in the PA interview process. In regards to our who and our why, we realize that there is a scarcity of freely accessible resources that deliver meaningful and positive impacts for pre-PA applicants. Our group aimed to mitigate this by decreasing anxiety and improving accessibility associated with interviewing skills. We wanted to work together towards alleviating the barriers faced by many aspiring PA applicants. Once PAs get an application or send in their application, they're often stumped when they reach the interview. So, this is where our group wanted to design an intervention that provided meaningful and a measurable intervention to ultimately decrease anxiety revolving the PA school application process and interview.
To support our research hypothesis, we wanted to do some investigations and look into the literature to see if there was anything to kind of support these questions that we had. So we found that many researchers found that poor sleep can negatively impact a student's ability to manage stress, and that there are many causes of stress that can lead to anxiety, many related to extensive curricula, numerous academic requirements, or frequent examinations that students have to take. This same researcher found that 756 medical students in their study, which is about 53.2% of those medical students, were stressed, and 75% of those students had poor sleep quality. The research study demonstrated that these high levels of stress can lead to poor sleep, and so it further exacerbates their mental health conditions, it worsens their anxiety, and leaves them predisposed to depression. Further research from different investigators found that higher levels of stress and anxiety can lead to the following: poor academic productivity, higher rates of depression, increased academic failure, and higher incidence of dropping out. The researchers found that resilience activities and well-being support from the higher education institution for these students can remedy the stress, improve their grades, and improve overall how they perceive their academic stress and stressors. So higher resilience predicted lower depression scores, and that was statistically significant. So while there's growing literature examining depression, anxiety, and burnout in medical students, we found that there's little research to support that in PA students and pre-professional health students. So we dove into the literature, found a few articles to support our investigations, and we found that research study investigated 320 PA students, demonstrating that these PA students were at risk of increased depression, anxiety, and burnout compared to the average population. Another research study found strong correlations between anxiety, depression, emotional exhaustion, and the results from this study indicate that depression is highly associated with emotional exhaustion and cynicism, while this anxiety is significantly related to emotional exhaustion. So all in all, these research studies support that poor sleep quality, little access to mental health resources can further exacerbate the worsening anxiety that these students have trying to enter into PA programs as pre-health students.
In terms of health literacy and cultural humility, we decided for our target audience to be around 50 pre-PA students preparing to send in their application within the next 2 cycles, and are currently working in healthcare taking patient care hours because we thought this would be a group that we can help the most. In terms of survey and intervention, we limited our survey and our presentation to 3 syllables for ease of understanding and accessibility to information. In regards to demographics, our target audience was an ethnically diverse group that consisted of participants being a part of minority groups largely. So we felt that we were able to, I guess, cast a large net and help many people from different backgrounds. We also know that this group of people may have lack of support at home. So we decided for our intervention to create a worksheet outlining their support network during the intervention period so that they are able to identify their support groups. In terms of communication, we spoke in clear and easily understandable language during the intervention, and we encourage questions for clarification throughout the entire process. In terms of advocacy, we know that the PA application process can be a financial burden, so we offered 6 different mentorship packages for students to take advantage of because it's a free resource. And then lastly, for trauma-informed care, we know that there's stigma regarding mental health. So we sent out the needs assessment anonymously. And afterwards, we know that rejections are also a sensitive topic. And so we streamlined our presentation and advice to not single anybody out, but to also provide meaningful advice and intervention so that they can benefit from that. For our pre and post survey results, this was one of the questions that was asked before and after the intervention about anxiety levels regarding to the interview process. And we can see that before the mean scale was 4.2, and then after the intervention, the mean was 3.2. So it led to a 1-point reduction of feelings of anxiety for the interview process.
Continuing to discuss our data, a second question was about confidence in their ability to manage anxiety related to the interview process. The mean prior to our intervention was 2.7 and post our intervention was 3.5, showing that there was an increase in confidence in their ability to manage anxiety related to the P8 interview. And then this was more of a qualitative measure. So we didn't calculate means for this particular data, but we asked which anxiety management strategies that they were currently incorporating into their routines. And you can see on the left that the majority of the students were already incorporating a lot of different anxiety management strategies, but one of the ones that we hoped to see improvement on is third and fourth down on the list is mindfulness and grounding exercises and redirection techniques in the moment. Those were both things that were taught during our intervention. And we can see that prior to our intervention, only 9 students said that they incorporated mindfulness techniques and 5 said that they incorporated redirecting techniques. And then after our intervention, those numbers went up to 23 and 18 respectively, showing that there was an increase in the use of these techniques after they were taught them by our team.
We also measured how comfortable the students were in talking to their peers about their anxiety specifically related to the interview process. So we gave them a worksheet where they can identify exactly who they can go to when they have certain situations come up. And one of them was interview process. So before the survey, before the intervention, it was 3.7 and there was an increase to 4.1. So there was a 0.4 improvement in their comfortability in talking to their peers. We also measured how confident they were with the interview competency. So pre-survey, they were at 2.7 and post-survey, they were 3.5. So that was a 0.8 improvement in their confidence. And in terms of likelihood for seeking mental health professional help was 3.2 pre-survey and post-survey was 3.7. So that was a 0.5 improvement.
So after reviewing all of our data, we found that our intervention successfully exceeded all of the objectives and goals that we had for our project, which is shown by the post-survey data when compared to the pre-survey data and showing all of those improvements. To sum everything up, we found a significant decrease in anxiety about the interview process, with an improved outlook on PA school interviews in general, an increase in confidence and ability to manage their feelings of anxiety regarding interviews through various techniques that we taught them, increase in ability to talk to their peers about their anxiety, increase their interview competency, increase in likelihood of seeking professional mental health services for their anxiety regarding interviews. So overall, our intervention, which included the anxiety interview presentation, resource handbook, Q&A, and education on anxiety management techniques, overall had a positive impact on mental health and interview preparation.
And as with most studies that we see in science and medicine, there's always room for improvement. There's always analysis for limitations also. And in particular, when we look at this study that we did, we want to also, for future research direction, to explore mental health in PA applicants also. So current literature addresses mental health of enrolled PA and medical students, but it leaves a gap in understanding mental health care challenges faced by PA applicants. So future research could focus on investigating the prevalence and impact of anxiety and depression, and even burnout among PA applicants. And that could be extrapolated to other professionals too, in regards to nursing, pharmacy, and dental students. So we can also look at a comparative analysis across professional health students in other realms also. In regards to limitations, we also need to look at the timing of the post-survey. Post-survey was administered after the intervention and may not capture long-term effects effectively. So future research could address this limitation by conducting follow-up surveys after a longer period. And this allows us to track the trajectory of the intervention over a course of a longer period, and it will provide valuable insights into unique challenges faced by the cohorts we looked at. In addition, we also looked at the representativeness, of the sample sizes, and the sample sizes in the current literature may not be fully representative of the entire student population. So future studies could aim to increase sample sizes and diversity to ensure findings are more generalizable to the student populations across different healthcare professionals also. And there's some study constraints, design constraints that we can also look at, and other researchers could look at. And the constraints of the study design may limit the ability to assess the trajectory of student anxiety over time. We can employ, as I mentioned, a more longer study, and this would include things like a longitudinal study to track progress of student anxiety levels after an intervention is done.
So like we mentioned earlier, the goal of our intervention was to provide free and impactful resources to students who are struggling with anxiety related to the PA process and interview specifically. Although we do feel like we made an impactful and meaningful intervention, we did encounter 4 obstacles and burdens along the way that I'll go over right now. These included financial burden, lack of free resources, lack of time spent with the cohort, and lack of literature focusing on pre-PAs. The solutions that we found to alleviate the financial burden was we strive to provide free resources in our pre-PA handbook that we handed out to all the students in the cohort that day. In regards to the lack of mental health resources, our goal was to help them identify their own support system in the workshop. And in our free PA handbook, we provided free mental health resources. And we also talked about various techniques that they can use in the moment when feeling anxious, including breathing and tapping. One thing we do want to mention was an obstacle was the lack of time we spent with the cohort. We were only given a 30-minute time slot to present to the group and include a Q&A session with them. So by providing our handbook to them, we wanted to give them something tangible that the students can use on their own time or when they feel like it's closer to their interview time as well. And then lastly, our final obstacle was that there was no specific research about mental health for pre-PA and PA students. So our group has talked about a possible publication for pre-PA students by working with our faculty in the ATED research course that we're all in.
In summary, 2 stars things that we thought went well. We were able to provide education and share personal stories about our own journeys with the cohort. And we saw that this showed an improvement in their mental health according to the pre and post collection data. So that was definitely a star point of our project. A second thing was that in identifying their own support system and obtaining some free resources for mental health that were provided to them in the workbook, they can utilize this during their application process, provided a lot of interview prep questions and other resources that they may not have found otherwise on their own. And those are all things that are free. So we were really proud to be able to put that together and provide that to these students. And hopefully that has a meaningful impact long term, even if that wasn't something that we measured acutely on the day of our intervention. And then one thing that we wish is what we discussed earlier is that we hope that there's more research and interventions that are done moving forward to improve the mental health of different pre-health professionals, especially in the application and interview process. There's a lot of data out there about how students do once they're in the program in terms of their mental health, but really not much data or support for their journey prior. And that's a big part of getting into a graduate program and a PA program is all the steps that it took to get there. So we hope that there's more research in that so that future groups can have more meaningful interventions for students moving forward. And our last slide is just our references for all of our data. Our question slide, which we will discuss in person. We appreciate your attention.